Hello, doctors. Again, thank you, Dr. Sherek, that you are going to record this session with me. I really appreciate your confidence to go through this again. Now we are going to discuss again a mental state examination, which is very common. It's about a man who is presenting to you in the clinic with symptoms of anxiety. Pay attention to what I'm going to say right now. Many times in the CASC, the main presentation is secondary to something else. And this is a very common station which typically demonstrate this trick. For example, this man is going to come with you complaining from anxiety, which is secondary to his auditory hallucinations. So if you take the complaint properly, you will not miss this primary and secondary issues. But if you do not pay attention to it, most probably you get confused and you might go through other areas in the examination. You will miss that this patient is basically hearing voices, and these voices are making him anxious. Okay?
Yes, sir.
Try to show empathy. Act as if you are confident. No one would know the difference, even if you do not feel confident. This is why we practice to appear confident, even if we do not feel confident. Okay?
Yes, sir.
Don't miss the first 10 seconds in which you show good impression about yourself. So nice gesture of respect to the examiner and the role player. Sit down, say your introductory phrase confidently, and start your task. Do you have any questions before we start?
No, sir.
Okay, doctor. Now we are going to start. As usual, we are going to do the station within 7 minutes, and then we are going to give you, I'm going to give you the feedback, and then we're going to do the tutorial of this station. 1, 2, 3, go.
Hello, I am Dr. Sharik. I'm one of the psychiatrists working here in the mental health unit. May I know what's your name, sir?
You can call me Brian.
Okay, Brian. And how are you feeling today?
Well, I'm not feeling good, doctor. I'm feeling tense most of the time, on the edge. I'm
really sorry to hear that.
Yeah.
Okay, I'm sorry to hear that. Can you please tell me more about it?
Doctor, I feel tense all the time, on the edge. Minor things puts me on the edge.
Okay, and since how have you?
Yes.
Yes, please continue. Yeah.
Yeah, you wanted to ask me something, no problem.
Yes, I wanted to ask, since how long have you been having this problem?
Well, since my last visit, I visited the clinic 1 month ago. It all started after that by 1 week. So it started 3 weeks ago.
Okay, and did any mishappening or any event occur prior to this 3 weeks that made you this much anxious?
My neighbors, doctor. My neighbors I think I'm anxious because of my neighbors. They are the ones who are putting me in this situation. They should be more considerate because I have my own needs, because I have a mental problem, so they should accept and respect this.
Okay, what is it that your neighbors are doing that you are feeling so anxious?
They keep calling me names, doctor, and I feel so distressed because of this.
Okay, have you confronted them about this? Why they are calling you names? Have you asked them?
I'm a peaceful man, doctor. I don't want to confront anyone. They can call the police, and I go through mental health act issues, and so I don't want to go through this again. I'm a peaceful man. I just try to forgive them and try to avoid them, but I feel so stressed.
Okay, I gather that you have visited the mental health services before as well. So what was the issue that brought you here in the previous occasions?
Doctor, I come to regularly to follow my treatment of schizophrenia.
Okay. And since when you have had this diagnosis of schizophrenia?
Since I was in the age of 20 years. I'm now 48, so 28 years now.
Okay, thank you for sharing this information with me. And may I also know, are you on some medication currently, and what dose is it?
Yeah, I'm taking my medications, olanzapine. I'm taking it regularly. Actually, it's helping me so much.
Okay, are you taking the medication on the right dose, or have you
Yes.
been not?
No,
Okay,
I'm
okay.
taking every day at 8 p.m. I take my medications.
Okay. So recently, have you had any stressor on your head that you have been thinking a lot about it?
Doctor, when I keep hearing them to calling me names, definitely I'm not feeling good. And I don't know what to do.
Okay.
I don't want to go through the Mental Health Act again and the police coming to my house. I want you to help me throughout this stuff.
Are you very certain that they are calling you names?
Yes, I hear them, doctor. I hear them clearly, like while I'm sitting in my living room, I can hear them talking with each other about me.
Okay, is there a possibility, a very faint possibility, that because of your prior mental health problems and the diagnosis that you're having, maybe you are just hearing their voices in your head?
No, doctor, they want to take my house because my house has a better place than theirs, and they keep talking about this, and they want me to they want to piss me off so that I leave. No, I'm sure that this is because they want to take my house.
Is this voice very clear, like how we are talking right now, or is it a very faint voice?
Sometimes it is very clear, sometimes whispering, but I can distinguish them, the man and his wife.
Okay, and there are two voices, the man and the wife.
Yeah.
Right?
Yes.
Are there more voices involved?
No. They talk with each other about me. Only him and his wife.
Okay, they talk about you between each other. Do they also directly refer to you like he's doing this or he's doing that?
Sometimes, yeah, they comment on look what he's doing. He's
Okay, they
acting like a
comment.
lunatic. Yeah.
Okay, they comment on your actions. Do they
Yeah.
also give you commands to do this or do that?
Sometimes, but I do not. They tell me leave the house. They order me, but I don't. I'm not going to leave my house.
Okay, I'm sorry to hear that. This all must be very distressing for you, and I can hear and understand how you must be feeling. And okay, I'm going to ask you some more questions about this, and they might be some strange questions, but these are routine questions that we ask in the assessment, so you do not become uncomfortable about it. If you do feel uncomfortable, do let me know.
Okay.
Okay, these voices in your ear, have you ever acted upon them when they give you commands?
No.
Okay. Sometimes this kind of distressing problems may lead you to have bizarre experiences. For example, having you see things that other people are not seeing. Have you ever had those experiences before?
No.
Okay, okay, maybe like smells. You're having some different smells, or maybe your taste is getting changed.
No.
Is it possible? Or do you also feel that your thoughts are somehow being altered?
No, doctors, can't you hear them, doctors? Do you hear them?
Okay, so I'm sorry to say I cannot hear them, but I can really understand that you're very distressed. Do you feel that your thoughts are being altered in some way?
Excuse me?
Do you feel that you are not able to think clearly?
Yes.
Okay, is it that somebody is removing your thoughts from your mind?
No.
Or maybe your thoughts are being known to other people?
No.
Okay, nice to know.
Thank you so much. Okay. How did you feel about what you did?
I was a bit more confident than yesterday.
Yes, that's good. That's why we practice.
Yes, sir.
Practicing makes you feel more confident. So what else did you feel about?
Time was little bit less. I wanted to probe for more psychopathology, check for insight. I wanted to check for insight. I wanted to check for other dimensions of thought disorders, but I could not make it in the right.
Anything else you felt you should have paid attention to?
Maybe I should have asked about more history, treatment history, past history, police history.
This is not history. Yeah, smoking risk. But pay attention to the first thing which we talked yesterday about. You must understand the context in which you are sitting with the patient in. If you read the station, which is station number 3 in the Get Through book, this patient has been coming regularly to the clinic since 20 years ago. Okay.
Yes, sir.
And he is a known patient.
Yes,
and you talked with him as if you don't know this information. Pay attention to this. We are expecting from you as a professional to pay attention to the information and do not ignore this because you wasted time asking him about his diagnosis and if he has been coming to the clinic and so on, as if you didn't read the information which is given to you. And if you have a chance to have a look at the mark sheets, there is a point about how you are able to use or make use of the information you are given about the situation. Sometimes long signposting. Long signposting is not good. So if you want to ask him about the sensitive area of psychosis, I would like to ask you some questions about just about what you have been experiencing in order to understand more what's going on. Is it okay for you? If you feel uncomfortable, just tell me. But though what I've said can be a bit long, but what you said was much, much longer. Okay. Be ready with some phrases which should help you in these situations. Don't waste your time because you didn't cover all the station in 7 minutes.
Yes, sir.
I showed a hallucinatory behavior and you didn't comment on it. Comment.
Okay.
It seems that you are a bit distracted. Tell me more about what's going on. So you hear the voices. I showed to you that I am distracted, but you didn't pay attention. As I told you, commenting on the overt behavior which the patient is doing as part of the mental state examination.
Okay, sir. Yeah.
Screen with you, and
yes, sir.
So let's see what do we have here and what did you do. Slideshow. Let's see. So this is basically what you should start with. So we asked about the onset, okay?
Yes, sir.
And you should have asked after that more about what happened after hearing these voices. What happened after that? What did you do? So you are hearing the voices. What else? You did assess the particular psychopathology, which is the main problem, in a good way. Okay, but you missed. What is your explanation? How come he is sitting in his living room and hearing their voices? This question, many candidates do not pay attention to, though it is very important. You must understand what is the explanation of the patient for this experience.
Okay, sir, but the patient himself told that he wanted a better house. He gave the explanation.
Not why we are talking about him. How come he is hearing the voices of his neighbor while they are in the other house, while he is sitting in the living room? So what is the explanation for this? Okay.
Yes, sir.
Could be there any other explanation, and so on. And before that, you should have asked him about, you asked about the predisposing, but start with open-ended question. So before, you told me that it started 3 months, 1 or 3 weeks ago. How was everything before that? Open-ended question. Anything that you would like to share with me and ask him about a couple of issues of substance misuse, any stresses, stopping medications, and so on. Delusional mood, and that's it.
Yes.
Again, very good. You introduce yourself and ask me about my name. Very nice. Okay, but again, your introduction was missing your understanding of the context. Don't give bad indication in the very first 10 seconds. Actually, you have no right not to be fantastic in the very first 10 seconds. As I said, enter the station confidently, show gesture of respect to the examiner and the role player. Sit down, say an introductory phrase confidently, and understand what is the context which you are supposed to be in. Unfortunately, you did not pay attention to the details that this is a patient who is following you up regularly and he has been diagnosed with schizophrenia for 20 years. And you asked some questions which showed that you didn't pay attention to the important information about the context, and actually this is not a good thing about you if you are going to go to the exam. In the assessment, I mean. In the general, when I showed that I am distracting, you should have commented on this. Okay, they instruct the role players to do everything for a reason, and they are expecting from you to do the reciprocal reaction or reciprocal comment according to what you are going to say. The speech, well, there was nothing in the speech, but again, the journal you should have paid attention to. You showed that I am distressed, but you didn't pay good attention to my hallucinatory behavior.
Yes.
Because again, the perception, you covered it, but you didn't cover the persecution. Well, who else was there? Okay, broadcasting, thoughts, and session withdrawal, you covered most of them. Degree of conviction, you covered. Perception, his explanation, you did not cover. Okay, so and the perception, the other modalities of the perception, you didn't cover. You approach the psychosis in a sensitive way, but again, try to use a sentence which is more palatable and short. No need for length signposting.
Yes, sir.
You didn't comment on the mood. Most probably, all what you could have needed, just 2 questions about the mood, the screening questions, his mood, and his the loss of interest. The cognition, you could have asked also, because definitely if he's hearing voices, his concentration is going to be affected. How he's doing all this, you didn't comment. Any suicidal thoughts, you didn't comment at all about the risk, and this is one of the most important things which you should pay attention to. They are not going to pass a candidate who is not paying attention to the safety of the patient. They adore safe practitioners. Okay, the insight, you asked me in the middle about the insight, but I felt that it was not in the right place. Okay.
Yes, sir.
Should have actually decided at the end to assess all the experience which he's passing through. Okay.
Yes. Yes, sir.
Termination, you didn't have the time to terminate. I feel because you are anxious, you are using too much closed-ended questions. Try to use open-ended questions. This will help the role player to talk. And all what you are going to do is just to highlight or repeat what he's saying. So you feel that they are trying to get you, or 2 persons talking about you, okay? Let him talk and elaborate more about his story, and all what you are going to do is just highlight or repeat what he's saying to make the examiner know that you are paying attention to what he's saying and you are addressing the psychopathology. But using too much closed-ended question will consume the time. Okay, now we are going to repeat this station again.
Yes.
And we are going to repeat it without time. Watch the cursor, the arrow, while we are going through the station, and try to improve your performance according to our feedback. Okay?
Yes, sir. Yes, sir.
Do you have any questions?
No, sir.
Okay, let's start. 1, 2, 3, go.
Hello, I'm Dr. Sharik. I'm one of the psychiatrists working here in the mental health unit. May I also know your name?
You can call me Brian, no problem.
Okay, Mr. Brian, it's nice to meet you. I really appreciate you coming here and seeing us today. I gather from your notes that you have been coming to the mental health unit for the last 20 years.
Yes.
Yes. So, sir, what brings you here today?
Well, I'm coming for my regular follow-up, and also I want just to tell you that I'm so stressed also. I'm on the edge most of the time.
I'm really sorry to hear that. What makes you so much stressed? Can you please elaborate further?
Well, all my neighbors, doctor, they keep saying names about me, and not because I'm a mentally ill person. They should do this, and I'm afraid that if I do anything, they will call again the police, and I get admitted under the Mental Health Act. I want you to help me.
Okay, we are here to help you. I mean, I'm really sorry to hear that. What is happening to you? Why are you
Doctor, they
looking
keep
up?
talking, doctor. They keep talking about me. I'm not comfortable with this.
Okay, I'm sorry to hear that. Let me come back to your neighbors again. You're saying that you're hearing their voices. Can you tell me
Yes.
more about it? What do they say to you?
The man and his wife want to take my house because it is bigger, and they keep talking with each other about this, and they decided to piss me off and call me names in order to leave the place. And I hear them while I'm sitting in my living room. They keep talking about me and saying bad things about me.
Okay, so there are two voices, the man and the wife, and they are talking about you while you're sitting in your own home.
Yeah.
So I want to ask you, how is it possible? I'm sorry to say, you keep looking up on the ceiling. Are you still hearing the voices again?
Yeah, sometimes I hear, I don't know how come I can hear it right now.
Okay, Mr. Brian, but I want to ask you, how is it possible that you can hear their voices while they are sitting in their own home and you're sitting in your house? Is there a method or is there a way in which you are connected to them?
Well, I don't know, doctor. Maybe they have some device which makes me hear their voices while they are not around me, in order not to be just, I don't know. I don't know.
Okay. Tell me more about this device. What kind of device is this?
I don't know. All what I can
You don't
say
know.
that I hear their voices. They must
Okay.
be having something which makes them do this. No,
So is there some other person also involved in it?
no, no.
Only them. Okay. So tell me about these voices. Do they refer to you in person? For example, he's doing that,
Yeah, they
he's
call
doing
me
this.
by name. They call me by my name.
And do they comment on your actions? Okay, he's doing that or he's doing this.
Sometimes.
Okay. Have they ever given you commands to do particular things?
Yeah, they are. Keep telling me go out of this house, but I don't. I'm
Do
going
you
to
feel
stay.
compelled to act on the command?
No, no, no.
Okay. Thanks for sharing the information. Because you are so distressed, so preoccupied with these problems, sometimes people can have different bizarre experiences. Do you anyway feel that your thoughts are being hampered? You're not, or for example, you're not able to think clearly.
No, no, no.
Okay, okay. For example, your thoughts are being taken away from your mind, or something like that.
No, no, no.
Okay, because of this distress, have you ever felt something like the life is not worth living, or you have had in your thought that you
No,
should end your life,
no, no,
or maybe you were thinking about confronting your neighbors or doing something to them?
no, no, no.
Okay, that's nice to hear you. Um, Anything else you want to tell me about this?
Well, doctor, I want you to help me, doctor.
Okay, I want to also ask you, like before these problems started, were there any stresses at the beginning of the problem? For
No, nothing, nothing. We used to be good neighbors.
any, did you consume any substances, drugs?
No, no, no.
Were you compliant with your medication?
Yes.
Okay. And what about your mood? How has your mood been lately?
Well, doctor, I feel angry most of the time because I usually shouldn't do this, and I should get some protection from them.
Okay. What about your sleep?
Well, I'm sleeping well. I don't have any problem with the sleep.
Okay. And appetite?
Good. My appetite is good.
Are you able to concentrate on your work properly?
No, no, because they keep talking about me and I'm not able to focus.
Okay. Are you feeling forgetful these days?
Yes, yes.
Okay. Because of this distress, do you feel to cope with that, you need to take any drugs or alcohol?
No, no.
Okay. You never had any thoughts about harming yourself or him or the other neighbors?
No, no. Okay, wait, now, stop. So you are going to start a new thing, assessing the coping and the risk. Signpost. You have been through a lot of stress. How are you coping? Don't use closed-ended questions while you are starting a new topic. Okay.
Okay.
Any new topic should be a blend between one open-ended question and 2 or 3 closed-ended questions according to the importance of this topic. Now, you want to know more about the coping and risk, which is an important topic. Start by an open-ended question. You have been through a lot of stress. How are you coping with this?
Yes, sir.
Okay, and then ask him in particular about the drugs and alcohol, and then go through other items of the risk and coping. Okay.
Yes, sir. So, Mr. Brian, you seem very distressed about at the moment. How are you coping with it?
Well, I don't know what to do, doctor.
Have you ever felt like taking any alcohol or any drugs to reduce the stress?
No, no, no.
Have you ever felt compelled to take any action about it? For example, harming yourself or your neighbors?
No, no, no.
Have the police have been involved in any instance for the past 3 weeks?
No, no.
Okay, good to hear that. So because of all this distress, I want to ask you, okay, this is not the first time that you're seeing a psychiatrist or you've been visiting a mental health unit. Is it possible that there can be another explanation for these problems?
Well, I don't know, doctor, what's going on.
Maybe that there is some chance of your schizophrenia coming back to you.
I don't know, doctor.
Okay, maybe that the mind is playing tricks on you. Is it possible?
I want your help. I don't know what's going on.
Okay, Mr. Brian, we are, as a mental health unit, we are here to help you, and we are going to help you. We are going to approach your case in a biopsychosocial way.
No, you just wait. Wait. Just don't go through management issues. Yeah, terminate. Okay, thank you that you have been open with me about all these issues. There are many ways by which we can help you. I'm going to have another talk with you to see how we can help you by the medications and to talk with you about anything else which can be concerning. That's it.
Mr. Brian, it has been really wonderful for you to come here and talk about your problems. We are here to help you, and there are many ways that we can help you to resolve this problem. And I really appreciate you coming here. Thank you very much.
Okay, but that's nice, but really wonderful. I don't think that is too sweetie. Okay, so just not very professional. Okay, again, doctor. So what you did now, it just emphasizes the importance of taking the complaint in the right way. So you ask about the onset and then later on, and ask about the course and duration, but later on, after taking all this information, you found yourself compelled to ask about these issues. So in the beginning, try to take all the 3 points together because they are closely linked, and they will help you later on to save time and appear more organized, and will help you also to understand the patient's problem. And the candidates who do this, usually they are not going to be triggered by anything in the story. Because as you can see, you are going to cover everything, the onset, the course and duration, and what could be the precipitating factors or the predisposing factors, precipitating factors here, because most probably, as I said, the Royal College puts a particular symptomatology which is secondary to something else. Let us see what you did again. So this is for the complaint. It was a bit disorganized, should have taken it in more organized way. The mood, again, doctor, when you ask about the mood, you should assess it in a professional way. There are 2 main questions which you should always start with. Loss of interest and the mood. How has been feeling and also the mood. Yes, the sleep and appetite are important, but they're expecting from you to be a member of the Royal College, so you know how to prioritize your questions.
Yes, sir.
Okay. I feel now that You have improved rapidly, so I don't have any other comments, except that I felt that without the slides, you would have missed the mood and cognition, because when I just was showing only these 3 items, you stopped and then you went through the cognition and coping after showing the items. So you should have your own note in your hand. In the real exam in Sheffield, you are going to be supplied by a pencil and a small note. And in this particular, with these pencil, you are going to write down your mental state examination approach, how we are going to approach the mental state examination. Only codes, for example, the name of the patient is etc. The tasks, write down the task. The task is MSE. Just write these, the first letter of every one of these after the name of the task. Complaint, CO, G, S, T, M, C, C, just to help you to go through these items, because in the real CASC station, your anxiety will make you a bit disorganized. This piece of paper will help you to stay on track. You have improved so much from the last time to this time. Okay, I hope that now the backbone is that you are going to take all what we have discussed to practice it regularly with your colleagues. Now you know how to do the station. You understand what are the points which Dr. Sherik should focus on. And now it is your homework to practice it regularly with your colleagues. Thank you so much that you gave me the chance to help you, and I hope that...
Sir, I have one question, sir. Sir, do they allow for us to look at our notes during the exam?
Like yes,
looking down
but
at
not
the notes.
Frequent. Yes, but it should be not frequent to make to look as if you are losing contact with the patient. You have the right to have a look at the note, definitely, but not on the expense of your communication with the patient.
Yes, sir.
Thank you so much. It was very,
thank you, sir.
Very good station. Thank you so much.
Thank you, sir. Thank you, sir.